I've had two procedures, one on the top here, along the area here, and also on the crown area. And from the first surgery and the second surgery, I felt like that I was receiving great growth out of it within a month, and also had used the topical, which seemed to sped up and maybe even help keep the hairs healthier. After I had gotten my procedure, we had the grafts put in. I had about a total over 2 sessions of 4,500 grafts put in, and both times the grafts had, after the first month, had thinned out but then grew back, and within the first 2 to 3 months I had a consistent growth of probably about 1/4 inch to a 1/2 inch, and over the 3 to 6 months it just filled in. It got longer and then more exciting. It turned into 6 months, into a year, and has really flourished and thickened up. I certainly have enjoyed watching the progress of the grafts come into place and start giving me my new look. Really look forward to it for a long time, and I'm really happy with the progress. One of the major reasons I chose Dr. Cole for my procedure is the food method, because I was able to get any haircut that I wanted to without trying to hide my surgical scar from the other types of transplants that are available. The food was definitely the way to go for me. I was able to I like having a fade haircut, and I wouldn't be able to do that with any other method, and Dr. Cole sure has came to the plate and gave me a great food procedure. The procedure itself was pretty comfortable. We had a great staff to take care of me. Everybody's super nice. Everybody's super helpful. Anything I needed, they were right there with it. Just sit in the chair and get yourself comfortable. They have to numb you up, and just a little slight bit of pain to get started with. Anything that, as far as the procedure goes, that I've dealt with as far as pain level, certainly worth it for the result, in my opinion. Not anything that is unbearable or intolerable. I think that if it's something that you really want done, it's certainly worth it. I think Dr. Cole was great. He gave me everything that I asked for, and honestly a little bit more. I really felt like that he used his skills to give me the very best I could get with what I already have to work with. I went in with very little expectations, and he certainly exceeded my expectations by a long ways. Every day I wake up, I get myself ready, I look at my procedure, and I'm very grateful for his professionalism and his ability to be able to do the work that he does. Dr. Cole's office is exceptionally great. They have been able to take care of me, answer any of my questions, and very helpful in any way. Questions or needs that I've had, they certainly have taken care of me, and the politeness of their crew is exceptional. Over the years, I disguised my alopecia by shaving my head for a long period of time. It was a goal of mine to get a procedure done because it was something that I knew that I wanted. And after I got it done, I was super happy with it, and I realized that a lot of people that hadn't seen me in a long time had thought that I had more hair than they had expected, and it was a great compliment. And a lot of times I get compliments on my hair, and one thing I've noticed is I never did get a comment on how well my head was shaven. actually one of the most comments that I get on my procedure is how much younger I look with hair comparatively to having shaved head, which is what I was going with before my very first surgery. With the comments that I was getting on how much younger I was looking after my procedure, I started thinking about how in my 30s I was shaving my head and it looked like I was into my 40s. And now I'm into my 40s and I've got a full head of hair and I look like I'm just into my 30s. And hair makes you look younger, makes you feel younger. Totally excited about what Dr. Cole can do for you. My decision to get the surgical procedure had a lot to do with the opportunity to only walk into the office for one procedure and be back to normal life instead of trying to use topicals or medications where when I traveled that I would have to bring these items with me, a new daily routine. It's just something that I wasn't interested in. The surgery itself has got a higher percentage success rate, and that was the biggest decision for me of why I chose to get a surgical procedure versus trying medications. On my way to get my very first haircut in 15 years, and I was like, I wonder if it's gonna hurt, you know, just because it's been so long, and I kind of acted a little bit childish about it. But when I was sitting in the chair getting my haircut, the lady asked if how I wanted my haircut, and I hadn't had a chance to even really think about it much. And I asked for a fade, as you can see, and she says, well, that's what it looks like you got last time. And I thought that was pretty funny because it had been 15 years since anyone had cut my hair at all.
Sometimes a patient will come to me with an excessive degree of hair loss. And I always tell these patients that they don't have enough donor area to get a full result. In other words, we can't graft the entire head. But this is an example of a patient who had significant hair loss beginning at a very young age. He came to me and he was realistic in what we could obtain and what we could provide and the coverage that he could anticipate and expect. And so with that in mind, we began the transplant journey with him. It's an example of how having hair to frame the face adds confidence to an individual and restores their ability to function in life. It improves their overall social interaction with other people. It can be a real adjunct to the success of an individual on a personal level. So even patients with marked degrees of hair loss, if they have realistic expectations, they're not expecting to necessarily look like Elvis Presley when we're done, with a higher hairline, we can frame the face and we can give them a much better life.